get by. It resides between my eyes. Walk through the fire, came out better on the other side. See, life's like a beach if you find the sand. And right now, I feel like 100 grand.
You are listening to Inspired Insider with your host, Dr. Jeremy Wise.
Dr. Jeremy Wise here, founder of InspiredInsider.com, where I talk with inspirational entrepreneurs and leaders. Today is no different. I have Dorothy Czylyski of NFA Health.com. And Dorothy, I always like to, before I formally introduce you, I always like to mention other episodes people should check out of the podcast. Since this is part of the Top Agency series, a couple good ones. I had Kevin Hurrigan of Spinutech. He's been in the agency world, an agency since 1995. And he talks about the evolution of his journey in agency and entrepreneurship. So that was a fascinating one. I talked about with Todd Taskey. Todd Taskey, who also has the Second Bite podcast, basically helps match agencies with private equity and helps sell agencies. And he talks about valuations and the agency landscape. And sometimes those agencies get more on the second bite than they do on the first, because they sell the private equity and then private equity sells again and they have stake in that. So it was an interesting take on selling your business. And then another one was Jason Swank, who also talked about building his agency up to 8 figures, selling it, and then he has a separate business also buying up agencies. So that was an interesting episode as well. That many more on InspiredInsider.com. And this episode is brought to you by Rise 25. Rise 25, we help businesses give to and connect to their dream 100 relationships. And how do we do that? We actually help you run your podcast. We're an easy button for a company to launch and run a podcast. We do the strategy, the accountability, and the full execution. Dorothy, we call ourselves kind of the magic elves that run around in the background and make it look easy for the host and the company, so they can create content and create great relationships. For me, the number one thing in my life is relationships. I'm always looking at ways to give to my best relationships. I found no better way over the past decade to profile the people and companies I most admire and share with the world what they're working on. So if you've thought about podcasting, you should. If you have questions, you can go to rise25.com to learn more. I'm excited to introduce, as I was saying, Dorothy Czylyski, and she's an agency executive with over 20 years of success working with pharmaceutical clients across North America. And she founded her healthcare agency, No Fixed Address Health, which is NFAHealth.com. And she did it in collaboration with No Fixed Address Inc. And it's a rapidly growing consumer agency with a unique full service model of incorporating all advertising disciplines under one roof. Current clients include Johnson & Johnson Innovation, Novo Nordisk, Astellas, and many, many more. And her vision was to offer clients working in pharmaceutical industry a patient-first agency partner by bringing the consumer experience into the healthcare space. And Dorothy, thanks for joining me.
Thank you for having me, listening about my journey and how we do pharma advertising.
I want to talk about a little about your background and some of the lessons you learned there, and then transitioning into why and how you started your own agency. And you were telling me a little bit about a lesson you learned from a previous boss in an agency about people.
Yes, great question, because I've carried that forward 20 years now. So I've been working within the agency space for 20 years. My background is actually in science, which is what has kept me doing science and working with pharmaceutical clients. So I have a master's of science in pharmacology and clinical pharmacology. So I always thought I would be in the space, but I never, when you're young, you don't really know exactly what job you're going to get. So I had
What did you think you were going to do at the time?
A doctor.
A doctor.
Oh, yeah. I think a lot of us who are interested in science, we always think we're going to go to medical school. We're going to be doctors. That's what I thought I was going to be. And then as you grow up and develop, you develop other interests. So some of those other interests that I had was a little bit more in the, I'm not going to say marketing, because you don't get to do a lot of marketing in high school. You don't really know what that is. But writing, I was strong in English. I was a very good writer, considered myself creative. So that was like, maybe the right brain, left brain kind of thing, which I kind of developed a little bit later on. So when I was doing my master's in pharmacology, it's there that I got exposed to the pharmaceutical industry. During my master's, I was actually helping to run a clinical trial. And that kind of sparked my interest. I thought, well, that's what I'm going to do. I'm going to work for a pharmaceutical company. And so when I graduated, actually learned very quickly that I couldn't just go and be a marketer in a pharmaceutical company, because that's not where you start off. You could be a sales rep. So everybody knows what that is, right? A pharma sales rep. So that's what was offered to me at the time. I was early in my 20s, and it is not what I envisioned for myself.
Did you end up doing it?
No. I thought, well, I can't be a sales rep. I couldn't understand what the job was at the time. The way I pictured it when I was, 22 is I would have a, bag with medication, and I'd be driving around the city trying to sell it to doctors. That's what I thought it was. It is not that at all. But that's what I thought it was. And I thought, that is not what I want to do. And I actually ended up reaching out to a recruiter that that I knew. And she put me in touch with an agency. And I had no idea what an agency was. Again, it's not something that they expose you to in school. And she said, well, they really would love to.
After I started my agency, Dorothy, I still didn't realize I was an agency. So
right?
I'm like, oh, someone said to me, who's been in it for a while, you're an agency. I'm like, what's an agency? So even being an agency, I didn't realize it was an agency. So I get it.
True. What does that mean, right? Like, what do you do? They said, well, they really want to talk to you because you have a science background and you know how to write. Like, all right. So I went to this interview, and that was my first exposure ever. I was inside an agency and really just trying to understand what they do. And that's when I learned that their clients are pharmaceutical companies. And they do a lot of the materials, they produce a lot of the materials that a pharmaceutical company puts out or gives to their sales reps. But even broader than that, like slide decks for conferences, and maybe a detail aid that a rep would have, or a patient brochure. We go to our doctor's office and you get a patient brochure, those kinds of materials. I thought that was wild. I thought, an agency does that? In my mind, I thought, why doesn't the pharmaceutical company do that? That was my initial impression. And now, of course, it's because, they're not an agency either. They don't have these big marketing departments with, people who can write or are creative, et cetera. So I thought that was really neat, and I took the job. So my first job ever was essentially a medical writer, which allowed me to use the science that I learned in school. I could read a clinical paper and a clinical trial, and I could write information on it. So I could write a patient brochure. I could write up some slides with scientific information. I could contribute to a detail aid that a pharma sales rep would eventually get in their hands. So that's how I started. I loved it. I really, really enjoyed it.
What were some of the lessons you learned, whether it's in marketing, specifically in pharma, or, I'm sure there's a number of lessons. What was one of those?
Yeah, I think a really key one early on that I learned, I think that was related to, even what is marketing in the first place, was you need to be able to understand and figure out what is the so what of what you are writing. So that was really important. And it's not easy, right? We're used to, I can take a paper and write a slide deck, right? We can all do that because we can make a summary. That's what they teach you in school. But if you're trying to then put a bit of a marketing angle or spin onto it. You need to be able to take that information and come up with what is the so what of what I am writing. And that's not easy, because I learned not everybody can do that. I give a very good example. We had a couple of people with PhDs at the agency who were also medical writers. And some of them, and I can think of one person specifically, really struggled with the so what. Like, they could produce really beautiful slides, and then there wasn't that, like, so what's the punchline? And I remember my boss saying at the time, some people just get it and some people don't. Like, it's not a natural progression of your thinking. So that really fascinated me. And actually, I ended up taking some marketing courses as a result, because I've never done that. I always took science.
I was going to ask if you had any mentors, either actual mentors or books or courses, because, I've had a lot of, really, it's not easy. It's figuring out a hook. And this applies to any marketing. It applies to any email we send, anything on our website, anything. So what? What's the hook? What's going to get people in? And I've had a lot of direct response marketers on the podcast before. And it was like, I didn't realize as I started, kind of peeling off the onion, how many resources are out there on just this one, not small, but this one really important topic. So I don't know, if you had any mentors, whether it's distant through books or courses or actual mentors.
Sure. So courses for sure. That's just hearing that. I thought, ooh, like, I don't have any marketing training. I enjoyed the writing. I appeared that I was good at it. So maybe it came naturally to me. As my boss said, some people have it, some people don't. Maybe I had it to a certain extent, but then it made me uncomfortable. I felt, okay, I need some training here if I was going to pursue this kind of a career. So I did night school. So I was still working full time, and I took it was called a business management certificate at the time. That included, I had to take a series of 8 courses over, probably took me almost 3 years, where it was like marketing 101, corporate finance, business strategy, business fundamentals, kind of like like a mini MBA. And my work paid for that. So they did sponsor, in a way, help put me through. It took a long time because I was doing it at night, but that kind of just gave me a different perspective, because again, in university, I didn't take any courses like that. It was just completely science-based. So that really helped. And then, of course, doing your job, you gain experience writing, the various pieces that I was doing early on in my career. So kind of that in combination with the courses, I felt I got more confident in the role and just really understanding, what is it that we are here to do, what makes the clients happy, et cetera. Yeah.
So what was one lesson? What was another that you learned throughout your agency career?
So through my agency career, so that was kind of medical writing. I did that for maybe 5 years in my first job. And then I thought, okay, well, maybe time to move on and do something else. I was, and this actually comes full circle. So I'll mention it. I got called, a previous boss of mine that was working with me in the first job left and went to run a healthcare division at Publicis. Publicis had a healthcare division at the time. It was called Publicis Wellcare. She went there to be the managing director, and a few months after called me and asked me to come over. And because she wanted somebody who could do the writing, but also had the science background. So I made that jump, went over into Publicis, which is actually where I met Serge Rancourt, who was the president of Publicis at the time, who is now the founder of No Fixed Address. So I met him there very early on in my career. He was the president, and I was a junior kind of 5 years in experience, medical writer, essentially. So that's how we first met. But I went there. It was a big leap because I really enjoyed what I was doing. And then the agency, maybe a month in, ended up merging. So this is interesting too, because that's what agencies do. Publicis Wellcare merged with another agency called Publicis LifeBrands. Publicis LifeBrands still exists. They're based in New York. And so I didn't have a job at Publicis Wellcare any longer after 4 weeks, and they kind of put me into Medicus. So it was a different building, different team, different people. And a lesson there was, actually, it was a mentor now of mine that I've kept in touch for 20 years, the managing director at Publicis LifeBrands, who was waiting for me on the day, came and said, "We don't know what to do with you, really, because they just transferred you over here. So tell me what you do or what you've been doing in the last 5 years," which I did. And then
That's very
said,
assuring,
okay.
Dorothy,
Oh,
the
very
first
assuring.
day to say,
Yeah.
we don't know what to
Don't
do with
really
you.
know what to do with you, because there wasn't a role. She just had to kind of take me in because the two agencies merged, and she was very confident that we'll figure it out. But the words that she said to me, those words were, "Just do what you do best and we'll figure it out." That's what she said to me. So that's what I did, kind of gave it my all. And
were you worried about your job though at that time? I mean, because obviously when there's mergers, just they slash heads sometimes.
Absolutely. Yeah, absolutely. A little bit. I mean, I was young still. I didn't really understand what it meant. But I did understand because the boss who recruited me to Publicis Wellcare, she was no longer, because, well, you don't need, right? You don't need two bosses running an agency that just merged. So at least that part I understood. And of course I thought, wow, like, do I still have a job? They said, yeah, we've transferred your contract, just go there, but do what you do best and we'll kind of figure out where to put you. And I threw myself in like head first. I think I felt at that time that I really needed to prove myself. Like, I knew I was a good writer. I've had now 5 years of experience and I did well throughout. So that's all I could do, just throw myself in head first. I think being open to, meeting the people in this new agency. Who do they work with? What kinds of clients what kind of support do they need? So I did that a lot. Like, I didn't kind of retreat into a cubicle and just write. I made sure to introduce myself, let people know the value that I could potentially bring. And that was actually really important because I think that is what kickstarted my career in account service. Because again, I was a writer, and a writer is still a role that is very key and very important in agencies. Another type of role is account service, right? And in account service, they don't write. It's a different kind of, you're the one in accounts, you're the one dealing with clients. And in my experience at Medicus, I was working very closely with the account directors, which they valued my skills for the science background, mostly the medical writing, but then the science background, the fact that I was able to understand the drug that we were working on. I could explain the therapeutic area. They did not have science backgrounds at the time. Some do now, but it wasn't common 20 years ago. And so there was value there. So that's when I got to work with them. They brought me into client meetings. I started doing presentations in front of clients, again, mostly around my knowledge of this is the drug, this is the therapeutic area, et cetera, et cetera. So that.
Yeah, you have to be a translator in that sense, translate the science to layman terms and then layman terms back to science in that sense.
Exactly
At
it.
what point do you decide, I think I want to start my own agency?
A little bit much later, right? Of course, because I think we feel we had to. So I've been now doing this 20 years, and NFA Health will be 5 years in January. So this was now 15 years in. So what happened, probably I can explain very quickly within, I'm at Medicus, and then how do I start my own agency? So I did end up moving into client service. And that was, again, that same mentor who said to me, do what you do best. I worked with her for several years. She saw the value, saw that what I could do. And one day, an account director ended up quitting the agency. So, of course, now she had to backfill, and came to me and said, well, this person just left. You want to try being an account director? Because we need somebody. And I think you'd be really good in the role. Again, she's seen me now doing presentations. I had the knowledge, but I was just never in account service. And I said, sure, let's try it. I was interested in it. I said, I would love to do that, which is a weird path, because I had a colleague come to me when that happened and said, wow, a medical writer turned account director overnight. Like, how does that happen? There was a need, right? Sometimes if you're in the right place at the right time, things like this can happen. But I failed, actually. I had to have a good story for you guys. I failed initially because as an account director, you get different clients that you work with. You're not just working with one client. I had probably maybe 4 or 5, because I took over the client base that the previous account director was working on, and just had to figure it out very quickly. And so a very big learning that happened there is, because I've never done the role, one of the clients was actually right in the middle of filming a commercial for a drug. It was it was a birth control. Filming a commercial. It was in Toronto. And probably the next day that I became the account director, they're like, well, you're going to go to this studio with the client, because you represent the account. I have never filmed a commercial, been in production. I didn't know anything about the role, what to do. But again, I'm like, all right. So I went into the studio, I met the client, introduced myself. I had no idea what I was supposed to do. And I think over time, probably a matter of weeks, it showed. The marketing director at the company ended up going to my boss and said, like, this person, she's lovely, but she doesn't have the experience. Like, we're just not getting anything from her. I mean, I'm not surprised. I had no idea what I was doing. And he actually asked me off the account. Like, just, can you please find somebody else? Wait, I mean, for me, that's a big fail. I was just put into this new role, and he asked me off the account. That was one account. I still had, other clients. And I thought, okay, well, if somebody else is going to be managing this account, then I better figure out what to do with the other clients very quickly. Now, the other clients was a little bit different. We weren't making a commercial. It was, I would say, a little bit more traditional and more of what I was used to. And I dove in headfirst there, and that was successful. So what does success mean in an agency? I mean, the clients then really enjoyed working with me. The way that I was leading the team internally at the agency, I ended up growing that business that I was working on. I doubled it in probably 18 months or so. So I thought, okay, I can do this. And then that propelled me forward. I ended up leaving Medicus. I was there also 5 years, and went to another agency to run client services. I was VP of client services at another agency. And kind of quickly going to, that's kind of when it started. People started saying to me, like, maybe you should run your own agency, which did not even cross my mind at the time. It just sounded really hard. And then I ended up at a different kind of agency. They did more strategy and insight work and not execution. It was important. I'll talk about it why kind of later for a reason, but I ended up there. We did a lot of more strategy consulting for pharmaceutical companies, insight generation, market research. And they hired me to run their healthcare practice. So I was managing director of healthcare. They also had a big consumer arm working with Nestle and McDonald's, which, I didn't have any idea about, but learned the consumer space there. And then I became president. So there it's managing teams, managing operations, business operations. And I think it's at that time that I thought, I think I can do this, right? Because you're gathering experience from different places. And then when I ended up leaving there, because one of the partners sold to another partner, another one of these, what you talked about earlier, that's when I thought, what am I going to do now? And it's hard when you're a president of an agency to just go and find, I'm going to be president of an agency. Well, those jobs don't come around very often, right? And that's where somehow I thought back to, what can I do? How can I do this? And it just seemed really hard for me to just open up an agency from scratch. And as they say, like sit in my basement and do what, right? Try to get clients. You had no people, no capital, nothing, no support.
At the time, Dorothy, what was family life look like? Did you have married kids at that point? Because we're not just operating in a vacuum, right? I mean, you probably had other stuff going on in your life that would makes it difficult sometimes to do those things.
Yeah, absolutely. And actually throughout my career, being in account service does require a lot of travel. So in the 15 years leading up to when I started NFA Health, my kids were young and I was traveling a lot and it wasn't easy. I can tell you my husband did not enjoy that because I was traveling. Sometimes I'd be on a plane once a week, not for any long stretches of time, but even going for a day is a 16-hour day if you have to get on a plane and go to a meeting. So my kids were little, 5 years. So my kids are now 13 and 16 today. So 5 years ago, they were 8 and, 11. So bigger, but definitely not independent. But absolutely, then it's something, at that point, you're having conversations, right? With your family, with my husband. He was actually very supportive. I think he also believed that this was something that I could do. And was. So he's like, yeah, you should do this, start your own agency. Actually, he said, we'll try it for a year. That's kind of gave that leeway, and see what happens. We'll try it for a year. And I get it, he was working also full time. So then what ended up happening is I approached Serge. We were connected throughout my career, even though when I left Medicus, probably in the mid 2000s or so, I wasn't in touch with him, but LinkedIn makes everything a very small world. So if people move around, you kind of have a sense, right, of what people are doing and where they're going, even though you're not connected. And actually, that's exactly what happened with Serge. He, after many years, left Publicis and opened with another partner an agency. So I kind of knew he was doing that. Then I was very aware that him and Dave started No Fixed Address Inc., which started in 2016. A lot of press releases at the time were coming out about this new agency that was on the block. So I started reading those, what's Serge doing now? What's the philosophy? And I liked what I read. the philosophy of no fixed address was not that we didn't have an address. We did, because they had an office from the very beginning. It was a no fixed philosophy. So from the beginning, from all the experiences that they had, Serge coming out of Publicis and his, great experience in agency world, Dave LaFond having run Cassette in Canada and being part of Publicis Proximity, they had a lot of experience, and you kind of gather what the need is in the market. And what they felt the need in the market at the time was, we kind of have to go back to the Mad Men days. I'm sure we've all watched Mad Men, where, an agency was able to basically provide and do for the client whatever they needed. See, the market was very fragmented. I think kind of post that digital, where everyone started splitting up, and we're now a digital agency and we're a creative shop. We do market research. And what started happening is clients were working with 5, 6 agencies on one brand. Why? Well, because this agency has this expertise and this agency has that expertise. And it kind of made sense. That's how they explained it to themselves. Well, I need these different partners because they have varying expertise. And of course, I want the best partner to do what I need. But it was very fragmented, inefficient, right? Expensive, probably took a lot of time, like for clients specifically. And then the client, if you're managing 6 agencies, well, you're a project manager a lot of the time. And then you're explaining the same things over and over. So Serge and Dave's idea was to kind of bring that back. Can we do everything for that client in a one-stop shop? And it's not to say that we're the agency that knows and that can do everything. It was, can we bring in the expertise that is needed, those subject matter experts, whether you're a creative, whether you're a digital expert or have, UX lead or media or public relations or production, right? Those are all components that, working with the client, you need to make something, whether it's a brochure, a website, a TV commercial. The idea was just bring that all in-house and offer it to clients as a one-stop shop. So it was the no fixed philosophy translated into no fixed solutions. And it was about solving for the client and not selling, that one thing that we were capable of. And I really liked that. So that kind of truly full service model was a big part of it. The digital expertise at the time, that was important. And then strategy. I think strategy was really important. Dave's wife was one of the lead strategists at Publicis. And that was important too, because it's if you have good thinking and good strategy, then that translates into the execution. Like, what is it that we need to do? So I learned that when I was part of the insight and strategy company. You really have to figure out, what is the market looking for? In my case, it was, what does the doctor need? What are the patients looking for? You have to understand that first in order to come up with, what are we going to make for them that's meaningful, that's relevant, that, will make an impact, that will, get them to do an action, right? That's marketing at the end of the day. We want them to do something, but it doesn't just come. We have to go back to the market. So no fixed address was doing that in the consumer space. And after my 15 years of experience, I thought, this is what pharma needs that they didn't have. So there really wasn't an agency that was offering this truly full service one-stop shop. And I knew that, at least in the pharma space, I thought, well, that's really important to them. The second part was pharma and digital. I mean, I think pharma figured out digital during COVID, which was just like yesterday, right? So consumer space is very well ahead of that. So having that digital expertise, which no fixed address had, was the second component. And then just being strategy led. So again, coming out of and really understanding why insight and strategy is important and leading with that so that you can do execution well. I thought, if I can take those three things, which I know No Fixed Address has, that was what I asked myself. Can I introduce that model to the pharma space in Canada? And that's what I went to Serge with. So that was the vision that I had, the idea. I contacted Serge. He invited me to come to No Fixed Address and have a chat. And that's exactly kind of how I pitched it to him. I thought, you guys have a really good model. At the time, No Fixed Address was 2 years old. 2 years old, and they were 85 people. I remember that the day I walked in. So I thought, wow, for an agency that's 2 years old to have 85 people, clearly your model is working. You're successful with the consumer clients that you have. Can I take that model, Serge, and introduce it to the pharma space? Here's why I think it will work. Serge is very entrepreneurial, as is Dave. And they thought, sure, let's do that. They gave me a laptop. Pretty much that's all I got, a laptop, because I think they were taking a very big risk, and I understood that. And when my husband said, let's try it for a year, it was, you know what? I even said to Serge and Dave, don't pay me, because I need to be able to prove to you that I can do this. Don't pay me a president's salary, because then there's an expectation, right? If you're getting paid in terms of, what. So I really kind of came at it from an entrepreneurial perspective. If I was doing this from my home, nobody would be paying me either, right? I would have to go find the clients. I would have to find the work and then I would get paid. And that is the model that, working with the chief financial officer at No Fixed Address at the time, I said, I'll get paid when I bring in clients. And it would be very clear what that would be, because those clients would be pharmaceutical companies, which is very different from what No Fixed Address is doing. And January 2019 is when No Fixed Address Health opened its doors. We created a press release to announce that No Fixed Address is going into the healthcare space, which is exactly what it was doing. And I started reaching out to my network. That's how it started. Just from the 15 years that I've been working in the space, I started contacting people and saying, I'm now doing this. Remember, we had a good relationship. We worked very well together. I am now part of this agency. Here is what we offer. And it was a lot of coffees and a lot of meetings. I had a spreadsheet that I wrote everything down on. And the goal really was to have as many conversations, coffees, meetings, whatever it is that they wanted as possible. What was
the first, maybe you can't share names, but the first big milestone where you got a client?
Yep. I remember it well, of course, because that was the first time we ever got to record revenue. So it took a while. I think over probably 200 meetings, coffees, chats with potential clients. I'll tell you, we're all like human and we all knew each other. So if I knew you and we had a working relationship and I came to you and said, hey, I'm doing this, you'd be like, great, Dorothy, congrats. That's amazing. Let's have a coffee. Of course, right? You'd welcome the meeting. We would chat. The problem was these were pharmaceutical companies. It's not that easy. You need a master services agreement to work with them. Nobody is waiting for an agency. Everyone's like, well, we have agencies that we work with. So the idea was, can we get a project? Can we do something given this unique model that we have, the capabilities that we have? Is there something that you can give us? I understand you have an agency and I understand I don't have an agreement, right? Could we do something that's project based? That was the idea, because I had to break in somehow. So one of those meetings, again, somebody that I actually worked with at Medicus in my agency life was working at a pharmaceutical company. And she said, we were sitting over lunch, and she said, and this was July, remember it well. So it was 6 months in. She said, we're putting out a request for proposal, RFP, which is what companies do, right? That agencies pitch on. We're putting out an RFP. We want to build like a really cool, interactive, digital medical education program for physicians. I said, please give me an opportunity to respond to the RFP, right? Like it's no kind of skin off her back because she could give the RFP to whoever and it's competitive. So RFP's what? I'm like, just give me a shot to respond to this RFP. She said, yeah, sure. I can send it to you. That's no problem, because then it's on us to come up with whatever it is that they were asking for and present it back. But I remember at lunch saying, Dorothy, do you know what the budget is that we have to build this digital, innovative medical education program? I said, well, I mean, I have no idea. And she looked and said, it's $800,000. I'm like, wow, like they're clearly looking to do something really big if it's $800,000. I thought, well, I have to try. I mean, I had no idea what I was going to do at the time. Give me the RFP. I got it. I spent all of July figuring it out, writing it, of course, working with the team. Like I only had 2 people at the time. I myself and I hired one other person who's now my business partner. And from a previous company, he ran insight and strategy there. And knowing if we're going to lead with insight and strategy, that's who I need to have. So we were working together along with the digital team at No Fixed Address. And we came up with an idea for this medical education program. It was a choose your own adventure for physicians, where we thought we're going to incorporate video, we're going to record patients talking about their experiences, and then based on what the patients said, and the physicians would be listening to that, they would then choose the appropriate next step. So that was the idea that we had for this program. And we built it out into like a proposal and a presentation. And we went into big boardroom in this pharmaceutical company, and we knew it was competitive. And we won. We won this project. And it was a project, but it was big. Yeah, it was exhilarating. I mean, the idea was very good. And I knew kind of in the back of my mind, like they have to pick this. This is so good. Like it's going to be amazing if they do this. And we won it. And of course, that project was going to take, I think our timeline was probably 6 months to build this platform. But now knowing that, we would have the budget, that kind of allowed me to hire, I think I hired maybe only like 2 people because we were working with our digital team at No Fixed Addressing to build this thing. But that was the first, as you ask, big project that kind of, I don't know, set our trajectory and put us forward. And then somehow, I think people say the first one is always the hardest, and then the second and the third somehow just comes. And that's exactly what happened. And then we started getting, another pharma company asked us to do a workshop. Again, another project. We did a workshop. And another company towards the end of 2019, towards the end of our first year, asked us if we, again, RFP, to be an agency of record, which, again, that was another big opportunity, because being agency of record now means you're no longer just doing one project. You now have the opportunity to do everything that that company needs for that brand. So pitch that, we won that. So we now had agency of record, we had this project, we had other little projects. So by the end of year 1, we were 5 people at No Fixed Address Health. And I think we tripled our revenue goal, because initially, I think I said to Surgeon Dave, if we just break even, then they're really not making any investment, right? If we're breaking even, we'll kind of see what happens. And Dave always would say to me, I would always kind of meet him in the kitchen as we were making our morning coffee, because I would always report back how many meetings I had. Dave, this week, 9 meetings. Next week, I have 7. The week after, 14 meetings. And Dave was always like, just keep going, because having so many meetings, someone's got to give you something at some point, right? They're going to convert. And that's what started happening, I think, is just you have those conversations. And if you stay on it, if you keep following up, it takes a long time. I think for us, it probably took about a year. They started coming, they started converting. So we're now in a very different spot 5 years later, but it's been amazing.
Dorothy, I don't know if you still have a little more time. I have a couple more questions.
Sure.
I know I want to respect your time, but 6 months to get the first client, it takes a toll mentally, especially having 199 meetings and this is 200th. How did you keep your spirits up? You know, because now you say, looking back, we're smiling, we know what happened. But at the time, you're like, I'd be like, this is my 167th meeting. What the 5 months have gone by. I don't care if we say, oh yeah, we'll give it a year. Like, I'm still in my mind nervous. I mean, all these emotions would be running through my head.
Yeah.
How did you just stay positive and just keep going through that?
It's a great question. So, of course, I was thinking that. I think a big part of it was knowing I gave it a year, right? So I think in a lot of things, if you set a goal for yourself, often I think a lot of people will tell you, mentors, books you read, when you set a goal, don't just set a goal, but put it against a timeline, right? So I think it's for that reason, so that you don't give up too easily. And so my timeline was a year, and I fully realized, and I even remember saying to myself, if I don't get clients by a year, I will not have a job by the end of this year. I was fully aware of that. And so, yes, I had a goal, but then I also had a timeline. So I think maybe a little bit of that was knowing that we're still within the year, right? So July, yes, was a long time because it was that 5-6 months to get a first client, but I was still within my timeline. I am also in general a very optimistic and positive person. Always, for sure that helps. Like, I get criticized sometimes that I wear pink glasses everywhere I go. Like, the world to you is like rosy all the time. And it's the glass half full versus glass half. I'm always glass half full. Definitely that contributes, because then, you don't beat yourself up over it or think, well, like, this is impossible, or, oh, I can't do this anymore. Right. And you give up maybe too quickly. It's just stay within the timeline. And I think keep at it. And I did keep at it with the same like energy and like fervor that I had from day one, and just keep at it. Like, I was staring at that spreadsheet every single day. And if somebody didn't get back to me, I would follow up, and then I would record that. Did I hear back from this person? Do we have a meeting? We don't have a meeting. Let's get a meeting. Can I come? Okay. What is the outcome of that meeting? Well, they said to call back in 3 months because they might have something then. Sure. I would write that down. And then when that 3 months came, I would reach back out. Hey, I remember you mentioned 3 months. Is now a good time? Right. And you kind of, once you build up your list of contacts. So I was doing that very strictly.
I mean, logically, I realized, okay, well, the sales cycle may be 6 months or maybe a year or whatever it is, but emotionally, I feel like it still takes a toll, even though we know that. Mm-hmm. I'd love to highlight what you do for a second. And I don't know, I know we maybe only have time for one of these, but I know you did something in the prostate space. You did something in the overactive bladder space. I don't know which one would be best to kind of highlight. How does it work to work with NFA Health? What does it look like? Sure. Which one would be better?
Yeah, we can talk about the prostate example. So, what we do with pharmaceutical clients. So, as I mentioned early on, it's supporting the marketing teams that are within the pharmaceutical companies. There's pharmaceutical companies make drugs that they, I say sell. Doctors ultimately have to prescribe the product in order, for that drug to be sold in a way. So the doctors are the customers. They're not our customers. They're the pharmaceutical companies' customers. So what we do is make all of the materials that they would need, again, whether it's a patient brochure, whether it's, they want to build a website for that brand that a doctor might go to or a patient might go to. Those are two different kinds of websites, et cetera. But they also create campaigns, the TV commercials that you see, that is a big part of what a pharmaceutical company marketing team would do with an agency. So we create a lot of these materials. We create a lot of these kinds of campaigns. In the prostate case specifically, we're working with a company that has a couple of drugs that are for prostate cancer. So you need to be diagnosed with the disease in order to be prescribed these treatments. And there's many different treatments available on the market at different stages of your disease. And in this campaign, we were working with the client simply to make men obviously aware that there's many other treatment options that are available. It sounds common sense, but what we discovered through our insight and strategy process, which again is really important in terms of what are we going to say in the advertising, what is important to that patient. We discovered in speaking with men with prostate cancer. So of course, for the most part, these are older men. Men don't like to go to the doctor, right? Number one, it's usually like the wives or the family who tell them to go. And then if they go, it's like, oh, I'm going to the doctor. And then they kind of sit there and they don't say anything. They listen to what the doctor tells them. Okay, I'll take and they go do that. That for the most part, you're laughing because I think maybe it's true, but that is what we uncovered in speak. They'll talk to their buddies, their friends.
Well, I'm laughing, Dorothy, because I call myself a recovering chiropractor, and when a man would come in my office, I would say there's 3 reasons why you're here. Something's about ready to fall off your body. Your significant other told you to come in. Or it's a combination of the other two, right? And they're like, which one is it? Is 1, 2, 3? So it was usually one of those 3 options.
We weren't wrong. That's it. And so they find it really hard to have conversations with their doctor. And especially, as you just say, prostate, like it's cancer, it's scary for many people. But absolutely, there's things going on in their heads, right? They're thinking of so many things themselves. They're thinking of being well, having a good quality of life, surviving, supporting their families, their jobs. They have lives, of course, that they want to be able to maintain. And so the insight was, can we help these men have conversations with their doctor? And why would we want to do that? Is because we wanted to give them the opportunity to open up a conversation about treatment options, and not just kind of go and not say what your goals are. Men have different goals. I want a good quality of life because, or I want to extend my life as long as possible because, or, sometimes depending on the goals that you have, there's different treatments, someone may be appropriate for surgery. Someone may not want surgery, right? So that there's different circumstances. But if you're not having that conversation with your doctor, then the doctor often is just, guessing, and they do what they know to do or what they have done with other patients. So if we can just get them to speak, to tell the physician that was the goal. How do we get them to do that, right? Because if men can't open up, can we help them? So that was the idea behind the campaign, and it wasn't easy. And what we ended up doing was the campaign was called Crucial Rehearsal, right? Again, if you don't know the words to say, then you rehearse. We have to give you something that then gives you the confidence, the ability to be able to say what you want to say. So
yeah, because sometimes people don't even know what questions to ask. Right?
That's exactly it.
Yeah.
Actually, it's part of men don't know what questions to ask. So we created a website. It is still live. It's called crucialrehearsal.ca, not .com. It's .ca because it ran in Canada, crucialrehearsal.ca. And you'll see on that website, what it gives men is 3 questions that they need to answer. Again, we wanted to make it quick. We wanted to make it simple because we wanted to keep the attention of the men that were going there. And the questions were around their goals. It was around their goals, their lifestyle, things that they wanted to maintain. That there it is.
So if you're listening to the audio only, you can see the video. There's a video here. We're looking at this is NFAHealth.com, but then we're at crucialrehearsal.ca right here.
Mm-hmm. And all they had to do was answer 3 questions. What matters to you most? What's your top priority? Right? Easy for someone to answer. You can click on that and in seconds go to the next one. Second question, what's most important to me? There various things could be, important to different people. And what am I most interested in as it pertains to my treatment? Really quick questions. And then that generated less than a 1-page script that, hi, doctor, I'd like to take a few minutes to talk to you about my prostate cancer care. And it incorporated the answers just from those 3 questions that they had answered. They could download it, they could print it, and they could just bring that with them to their doctor's office. Either if they're going on their own, they could even just read it and the doctor would know what's going on, or they could go, with somebody. But at least the idea was, those kinds of things that we know men were thinking about. It's, sometimes embarrassing to talk about. How can I bring that forward? There's a video on the website that kind of explains kind of the emotional state of men and, and why it's important to have that script. So it was very successful. That ran last year, and it actually was so successful that the company were doing another iteration and version of the campaign. It will also be called Crucial Rehearsal, but it will have a different insight attached to it, different creative and different executions. We're actually working on that as we speak.
I love it. And you could see here, there's obviously get the facts on prostate cancer. So there's a lot of information here, which has probably what you have found the most common questions. What is prostate cancer? What happens when it spreads? Treatments, side effects, all this stuff here is also on the website.
Absolutely.
I just want to first thank you, Dorothy, and thanks for going a little bit over. This is really fascinating. Your journey is fascinating, and your specific niche and expertise is really fascinating, especially in the health space. So I really wanted to thank you to share your journey. And if anyone wants to learn more, then go to NFAHealth.com. It had me hooked because when you navigate around on the page, it actually has this cool feature that is like you're actually looking at faces here. So I started to okay, what else is on here? And I'm poking around, but there's a lot of really good information. They have a news section, and just check out NFAHealth.com to learn more. And Dorothy, thank you so much.
Thank you so much. It was a pleasure. Thank you for allowing me to talk about what I'm passionate about.
Thanks, everyone.
Thank you.
What I got, you can't buy. It resides between my eyes. Walked through the fire, came out better on the other side. See, life's like like a beach if you find the sand. And right now, I'm feeling like 100 grand.